welcome to another episode of Ask the Healthcare Advocate Live. This morning, we're talking about something that's been in the media a lot lately for the past couple of weeks. If you haven't heard, that's a nice thing because it's kind of unpleasant, but there have been several gynecologists who've been accused of harassing, molesting, physically their patients in several major hospitals in Israel. And sadly, this does not surprise me, given many things that go on, but I thought it was important to note because the organization for the Association of Gynecologists in Israel put out a release last week, which said that they have revised their protocols and their what they are telling gynecologists, their practice protocols, what they should be doing in the office situation. And it was a little bit surprising because these are not, for the most part, new things. So I wanted just to review so that everybody out there is on the same page in terms of what is possible. No, I shouldn't say that. What your rights are when you go to a doctor's office in general and specifically to a gynecologist, so that there shouldn't be any question about what should be proper practice for you, and what you are able to do if you feel that the proper practices haven't been met. So first of all, there's one thing that the first thing that they said was that the gynecologist should explain every procedure to the woman thoroughly and tell her exactly what will transpire and what will go on and what will it entail. Will it be uncomfortable, comfortable, etc. So first, let me say that should be every doctor's practice, that every doctor should explain thoroughly, no matter what their specialty, thoroughly if they're doing a procedure or an examination, a physical examination, what is the examination for, what it will entail, if it will be uncomfortable, what its purpose is. That is something that should be just, as they say in Hebrew, muvan me'elav, take it for granted. So if that doesn't happen, it is your right as a patient to ask respectfully, but not only ask, but demand in a respectful manner that the doctor do that. That is what is supposed to happen. Now, yes, I understand that especially doctors in Kupat Cholim settings are very limited on time. Excuse me. Excuse me. They're very limited on time and they often feel pressured, etc. But it is the doctor's duty to explain to you exactly what is going to transpire, and it is your right to demand that information before any exam transpires. That's the first thing. The second thing is, as they emphasized in their protocol, that there should or there can be someone present. So let me clarify that what they call the Chok L'Zchuyot HaCholeh, which are the rights of the patient, which you see often in the walls of the Kupat Cholim, in the hospital, etc. The rights of the patient declare very clearly as of 1999, that's when they were instated, that anybody can have a companion or someone present when they're being examined by a doctor. And the only time that can't be met if there's some procedure occurring that they say that the other person can't be in, for example, if it's a surgery or it's a procedure where they need a clean room, etc. It's not 100% defined when that is that somebody has to leave, and there is for sure something that can be pushed. But if there's going to be a physical woman of one gender of another, then 100%, there should always be somebody else in the room that you can either bring with you, or if you're coming by yourself, then you can request that a nurse be in the room. Now, granted, that is supposed to be the procedure. We know that there in general is a nursing shortage. So it would be understandable that if a male gynecologist is examining a female patient, that there wouldn't necessarily be a nurse on call who could come in the room at the same time. However, that is your right. And for sure, you should request that if you don't go with somebody. And I recommend that you go to the gynecologist with somebody else. Always, just as a matter of course, unless you feel very comfortable with the gynecologist and you've known them for years, et cetera, and you don't feel that that's a different thing. Obviously, everybody makes their own, have their own balances, thoughts, etc. about this. I'm completely just translating from Hebrew. So it has always been your right to have somebody else in the room during an examination, and as much as you want. And it is your right. And if the doctor says the person has to leave and you say no, they don't, then the person needs to stay. So remember that thus it's always been your right. And even though that the Gynecologist Association is now reaffirming that, it is very has been evident, and is very important that we know that those are things that we always should, can, and are, as part of our global rights as patients. Now, what happens? What is your recourse if you have an experience that you feel is very untoward with the gynecologist, or you feel that they were extremely rude or invasive, or they were inappropriate in their words or actions, or you felt that they were really not addressing your medical issue in a negligent way? You have the recourse to complain. How do you complain? First of all, is you complain to if you want to do it in writing, you do it through the website of the Kupa. Every Kupa has a website called Pniyot HaTzibur, or public complaints, that you can enter in the information, and they do respond. They definitely do respond. If you feel that it's something that you could have a discussion with and have information about, and want to let the doctor know in a sense, so then you can go to the branch manager and register a complaint, either verbally or in writing, which is much stronger. So instead of getting into an verbal argument, I recommend that you do give in writing to the branch manager. You give in writing to the Kupat Cholim, the administration, through the website. And if you want it to be officially registered, then you go through the Ministry of Health has a special platform to register complaints. I will put the link also in the comments in this Facebook Live, where you can go in and you can register. You really need to put it in Hebrew, and you register a complaint about that specific doctor. So you need their first name and last name, where they're practicing. You don't need their license number, I believe, though, and if you have that information because they've given you a summary, you can put that in, and that's how you make an official complaint. So I hope that was a little bit clarifying as to what your rights are as a patient in terms of physical examination and recourse if you want to complain. Thank you always for joining me during my Facebook Live every Sunday, usually between 8:30 and 9. Today we were a little bit delayed. And if you've got any questions or comments, please feel free to send me either a private message or a comment on this live, and I hope to see you again next week.